So now we come to an important question called Nuremberg Code. Now, what happened is years ago, there was this Nazi concentration camps. And during the war, which was ongoing, and there were certain Nazis which were pushed into the concentration camps, they were used for experimentation of various drugs. Drugs, I mean medicines, which become medicines. So Nuremberg Code came into picture when it was noticed that people were misused for human experimentation. There had to be some guidelines put into place to ensure that such inhuman behavior or inhuman research or conduct under the name of scientific research does not take place. So Nuremberg Code is a set of ethical research principles for human experimentation, which was created by the court in US versus Brand. The Nuremberg Code aims to protect human subjects from enduring kind of cruelty and exploitation of prisoners endured at the concentration camps. Now, what happens is when a drug is under scientific revelation, first animal testing is done, and next, after that, human testing is done. So directly testing on humans or just making something and testing it on humans is wrong and it is illegal. Now, these are 10 points of Nuremberg Code. If you get your question as Nuremberg Code as short note or something, then one is write an introduction. What is Nuremberg Code? Give it a little historical background as to how it came into picture, why human experimentation came into picture, and how we are trying to stop it in today's times. So write at least 8 points out of these. If you can elaborate, you can be done with 6 points as well, and I'm sure you will score well. One is voluntary consent. Now again and again we are talking about consent because when it comes to concentration camps, I'm sure nobody asked for any consent, right? Without their consent, they were pushed into the concentration camps. So human testing at many places, even in the 70s, there were a lot of pharmaceutical companies which were doing human testing of drugs on people, poor people, maybe without consent or maybe even with consent, but they don't understand what they are going to face. What if the drug is not of good quality? What if it is something wrong? What if it is a horrible combination of two chemicals which are going to harm your body? People are not going to understand that. So voluntary consent is absolutely essential, as we saw earlier. Fruitful results, some data should show that this is going to give fruitful result. Of course, because we are trying to test the whole thing on humans. So you can't just play with someone's life. The whole, premise of having different codes, conducts, this Hippocrates oath, everything boils down to one thing, and that is protection to life. So every person's life is precious. You start off your answer with that, that is also fine. So see how you can connect points. One is fruitful results, and that should be good for the society. If it is an unnecessary thing, there is no need for human experimentation. That's what we are saying here. Next is it should be based on results of animal experimentation. As I said, there has to be some solid data that should show that it is important for doing the experimentation. One, it is essential to be tested on humans, and three, it should give some fruitful results. So all this can be seen in animal experimentation. I'm sure you will come to know about this a bit more if you have seen the movie Vaccine War. It is so beautifully shown in the movie that they test the injection, the vaccine on rats, white rats, and then they test it on humans. That's the patient, and they administered it to humans. So it's very important to understand that there is a procedure. You can't just go and give the vaccine or the drug to any human. So it should be based on results of animal experimentation. Next is it should avoid all unnecessary physical and mental suffering and injury. If it is too injurious, it is going to, say for example, to ail to cure an ailment of physical nature if the person is going to go mad and he's going to suffer an say partial or total impairment of mental capability. Is it even worth it? No, it's not. So human experimentation should avoid all these unnecessary injuries or sufferings. Next is there has to be a no priori reason to believe that death or disability may occur. Now, just I mentioned that physical and mental suffering cannot occur. So obviously death cannot occur. There has to be a reason to believe that such a thing will not happen. So say for example, someone says this is a life-saving drug. It is just administered to the human and the human dies after 10 minutes. So this has to be understood by the researchers, the scientific researchers who are doing or working on the experiment. You can't just take away someone's life like that. So there has to be a prima facie reason to believe that such a thing is not going to happen and such an injury is not going to occur. Next is the degree of risk to be taken should never exceed that determined by humanitarian importance of the problem. So what do you mean by humanitarian importance? We are saying that it is for good of the society. But doing good to the society at the cost of someone's life, is it right? No, it's not. So, degree of risk has to be least as such. Next is proper preparations should be made and adequate facilities should be provided to be conducted only by scientifically qualified persons. Now, you and me cannot just go and do something. Are we even qualified? We are qualified lawyers, of course. But are we qualified scientifically to go and perform certain researches? No, we are not. So, anybody who is having that kind of capability, maybe they have a recognition through their degrees, through their some certificate courses or whatever that is, they should be scientifically qualified professionals to do this. Just anybody cannot do it. Next is that human subjects should be at liberty to bring the experiment to an end. Say, for example, the person is undergoing a treatment. This is a new treatment, and at certain point in time, he is being prescribed for say 3 months of medication. After 2 months, he feels that no, the pain is increasing. This is not giving me any relief. And no, I want to end this. I don't want to continue. He cannot be forced. We spoke about coercion a few moments ago when we spoke about consent, free consent. So nobody can coerce, nobody can pressurize or force other person to take the treatment. So the person has to be at liberty to say, okay, I'm done. I don't want this anymore. This is harming me and I am getting very anxious and I don't want to continue. Then he should have the liberty. Next is the scientist in charge must be prepared to terminate at any stage. Say if the person says, I don't want to continue, the scientist should say, okay, and he should be able to terminate it. Leaving it in between may cause more harm to the person. So putting an end is important. So putting an end to the experiment is in the hands of the researcher or the scientist, and he should be able to do it at any point of time. That's what the Nuremberg Code says. Now, this is very simple to understand. If you remember keywords out of these 10 points, I'm sure you will be able to write, such as voluntary consent, good for society, animal experimentation, unnecessary suffering, death, a priori death or disability, degree of risk, proper preparations, adequate facilities, scientifically qualified professionals, human who is a subject is at liberty and the doctor is prepared to terminate. So it's very easy to understand. You can write an answer properly. Now, what happened after Nuremberg Code came into picture? There was something that improvised, and there was a Helsinki Declaration which came into force.